All right, we're going to look at the external of the eye. So first, what I want you to notice, I don't have really loose gloves on, so it's easier for me to manipulate the tools. Okay, and here is the eye. You're going to notice right here, see this sort of more yellowish colored tissue right here. This is going to be the fat or adipose tissue that is going to protect the eye and provide some cushioning. Okay. Then I'm going to rotate, and then you see this tissue which is a little bit darker. Here I have some great examples right here. This is a great cross section here. This is going to be muscle. So the eye has a whole lot of muscles that help it move in a whole bunch of directions. Okay. So I have this adipose or fat tissue, and then I have muscle here. Okay. In the anterior part of the eye, right, so that faces toward the front, I have the cornea. So that is, if this were a living cow, this would be clear to allow light to pass through. And then around, I have the sclera. So right here is a great example. The sclera around the cornea right here, and then the sclera. And then if I flip the eye this way, and I want to look at the posterior, I'm going to look for a really thick band coming out of the posterior of the eye. And this is the optic nerve. Okay? You can see how thick that is. This is carrying the signal, all those impulses from the retina to our occipital lobe. So right there. Okay? And now what we're going to do is use pins to label them. So I want to have my eye like this, where I have anterior this way and posterior this way, because I want to be able to label the anterior and posterior. Okay? So what I'm going to do is right here in the optic nerve, I'm going to put the black pin, okay, into that optic nerve. All right, so you can see that. All right, then into the muscle, I'm going to put red. Okay, so into that muscle tissue. All right, then I'm going to use yellow, and I'm going to put this especially off to the side, especially of a piece that's hanging off that's easy to identify, that adipose tissue. So I have black, the optic nerve, I have red for the muscle, I have yellow for the fat. Okay, then coming out the very anterior of the eye, I'm going to put a white one in here to indicate the cornea. All right, like that. And then I am going to use green to indicate the sclera. So I'm going to go back from that cornea. This one's a little harder to get in. And label that sclera. So I'm going to have to muscle that one a little bit. What I want to make sure is I'm going to be able to see all of these in the picture. What I'm actually going to do is for this pin for the optic nerve, I'm going to make it face out the other way. Okay, do you see that actually works better? So we have the optic nerve, we have the adipose tissue, we have muscle, we have the cornea, and we have the sclera. And then you're going to take a picture. Okay, so you have all of those pieces, and then you will remove the pins before going on.